I was like, yes, for sure, because still, I was diagnosed 6 years ago, and I still suffer from scan anxiety, with mine coming up at the end of March. So it's a really important topic, and I'm going to enjoy the presentation today as well. So I'd like to welcome all the participants up on the screen from the satellite locations from MD Anderson at Katy, League City, Sugar Land, and the Woodlands for today's Lunch and Learn. And today's session is a part of a 6-series session that will focus on wellness-related topics and is generously funded by the Department of Volunteer Services and Merchandising, and it's from the gift shop proceeds that we get to have these amazing Lunch and Learns. Before we begin, I'd like to bring your attention that the session is being recorded and will later be available to view on the My Cancer Connection website. And this is where you can go if you want to show anybody else or go and see it, or it gives you the information, the email address if you have any questions. If you don't want to ask questions here, they'll be available for questions afterwards. And we also have time at the end of today's sessions for questions. So we have these note cards that are available at your place. So if you have a question that comes up throughout the session at all, please feel free to write it down on the note card, and we will come by and get them and make sure those are answered. And so now it's my pleasure to introduce you to the MD Anderson experts that are here to talk to you about so I call it scan anxiety, but scan anxiety, I guess, is the proper medical term. We have Victoria Nicholas. She's a graduate of Tulane School of Social Work in New Orleans, Louisiana. Ms. Nicholas has been a social worker at MD Anderson for 4 years and is currently working in inpatient melanoma, sarcoma, and gynecological cancers. Oh, sorry, my hand did something weird. And then we also have Kristen Strength. She is a graduate of the University of Texas at Austin, Steve Hicks School of Social Work. Ms. Strength has been a social work counselor at MD Anderson for 6 years and currently works with outpatient gynecological cancers. Today's session will define and address scan anxiety. Attendees will learn how to recognize signs of scan anxiety, as well as explore practical ways to cope before, during, and after a scan. So please join me in welcoming our guests.
Thank you guys so much for being here.
Yes, thank you for having us. Thank you to Diana for inviting us, and we're so glad to be here with you all. Thank you for joining us today. We are here to talk with you all about something that most people living with cancer can identify with. That's scan anxiety. Scan anxiety can build for weeks. Bruce Feiler, an author and speaker, described his own experiences with scan anxiety in a piece he wrote for Time magazine back in 2011. He wrote, "As my scans approach, I become increasingly wary and deliberate in my actions. I put off major decisions until after I hear the results. My breathing gets tighter, and those regular drives to the clinic are among the most tense I have, though there's nothing I can do at this juncture to affect the outcome." These feelings may be very familiar to you. Hearing these words, we see that scan anxiety can dramatically impact a person's plans, behaviors, and quality of life. In some cases, scan anxiety may become so great that it impedes somebody's ability to carry out their responsibilities or even to experience joy. In some cases, the fear may even lead to not completing the recommended testing. We'd like to give you all a brief overview of what to expect during our talk today. To begin to understand how to address scan anxiety, first we're going to talk about what it is and how to recognize its signs. Then we're going to explore some strategies you might use to enhance your coping before, during, and after a scan or medical test. We like to get a feel for who's in our audience today. If you feel comfortable, would you lift your hand if you're a patient? Okay. Would you lift your hand if you're a caregiver? A lot of caregivers here. Okay. Any employees here? Okay. Okay. Volunteers? Okay. Because scan anxiety is something that we as oncology social workers discuss frequently with our patients, a large focus of our talk will address anxiety surrounding scans and medical screening for cancer. Based on your responses, though, we know that we have a very diverse audience here, as well as those that may be listening in today. You might have come here thinking that you would just listen to us talk today, but we have an assignment for all of you who are here. Anyone can experience distress related to an upcoming medical test. As you listen, we want you to think about what may help you be proactive in your healthcare and manage worry related to medical screening. What might you choose to use? There's not a one-size-fits-all approach when it comes to what works best to help you cope. Some of the suggested strategies will resonate with you more than others. The benefit for you of attending today's talk is that we hope you will identify some tools to help you feel more empowered and prepared for a future medical screening. While some anxiety is to be expected, ultimately we hope that the overall experience of a medical screening feels a bit more manageable.
Okay, so to start, we have to talk about what is scan anxiety, or what some of us call scanxiety. And so in defining that, the American Psychological Association defined anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. It's important to note that anxiety is completely normal. This is something that we all experience throughout our lifetime. And we experience it for different reasons. It might be that you have a big meeting coming up at work, or you're preparing to take an important exam, or to make a really important life decision. They're all things that make us feel anxious. There's an article that I read that described anxiety in two different ways. They talked about something called a state anxiety and something called a trait anxiety. So a trait anxiety, they talk about that as a personality trait that denotes the tendency to perceive stressful situations with a heightened state of anxiety. So this may be something that someone actually has a formal diagnosis of generalized anxiety. It may be managed by a doctor, through medication, or through counseling. It's something that you deal with on a day-to-day basis that you feel is sort of part of your personality trait. And then they talk about state anxiety. So state anxiety is an emotional response we experience characterized by unpleasant feelings of tension and apprehension when faced with a threatening situation. So when we think about scan anxiety, we can think of that as a state anxiety. It's this emotional response that we experience when preparing to take a scan or to receive the results of a scan. But no matter whether you have or don't have this personality trait towards anxiety, anybody can experience the state of anxiety regarding a scan. And there's two common reasons that we feel anxious about going through a scan. One is just the physical experience of going through the scanning machine, and the other is awaiting the results of the scan and what those results are going to mean. So why do we feel so much anxiety about scans? A lot of our anxiety is tied to our worries just about the unknown. We might feel a sense of loss of control or just fear about the physical discomfort of going through a scan. And we might worry about how the results might impact our lives. So throughout this presentation, what we want to do is instill you with strategies to help manage this sense of scan anxiety so that it doesn't interfere with your health care and with your overall well-being. So why do we go through scans? Why do we receive imaging? Why do we put ourselves through all of this anxiety? Both cancer and non-cancer patients receive scans for a variety of reasons. We receive them to evaluate a concern. So that concern might be examining whether we have a broken bone or just a fractured bone. We might go through an x-ray to determine if we have pneumonia. We go through scans to evaluate treatment response. So is the treatment that my doctor prescribed working for me? What's going on in my body? And to evaluate the status of that disease. Do I need more treatment, or was the treatment effective? So what scans do is empower us to know more about what's going on inside our bodies. Even if you don't have a cancer diagnosis, due to maybe your age, your gender, or your family history, you may have been considering going through preventative screenings. We participate in preventative maintenance for other parts of our lives. We go to the dentist and get regular dental checkups. We have x-rays to make sure we don't have cavities. We are constantly changing the oil in our vehicle to keep it running well. So why don't we participate in preventative maintenance for our own bodies? So some people might not know that MD Anderson actually has a preventative screenings department for those who are healthy with no sign of illness. So these screenings can help you to find cancer early, when the chances of treating the disease are at its highest. In your resource handout that we've provided for you today, we actually have a link to MD Anderson's Preventative Screenings Department for you to learn more. So the role of preventative care, of going through these screenings, is to identify any potential medical issue as early as possible to reduce the extensive nature of treatment. The earlier that you discover a medical issue, the more options that you have to treat it with your doctor. So by taking an active role in your healthcare, by going through scans, you're actually giving yourself more options and more choices for your future. You're staying informed and in control of your healthcare, and this is why it's important to consider screening.
To help you feel better prepared for screening, it can help to try to eliminate some of the unknown of what happens during a scan. I'd like to point out a wonderful resource available through the MD Anderson website that offers information about some of the most commonly performed imaging here. Let me just click over to that so you can see. This is called the Diagnostic Imaging Procedures page. We've included a link to that as well on the resources handout that you have. This page includes some videos specific to the most common screenings or scans, as well as videos. So if you go through on your own here, you can watch the different videos. Have one for breast imaging, CT, nuclear medicine, and it goes on down. During the videos, it includes some discussion of why certain scans would be selected and how to prepare for them. The video also shows the procedures being performed along with commentary explaining what's happening. We were so lucky to have the support of the diagnostic imaging team as we prepared for this presentation today. They led us through the imaging areas here at MD Anderson and provided us a lot of helpful information. They pointed out that with regard to completing a scan, the MRI in particular can often feel overwhelming because that's a very noisy machine and it can be a lengthier test to complete. Of course, every scan is unique and everybody responds differently to scans. This is why we want to help you be proactive in preparing for for the scans in a way that's most helpful to you. Let me click back over here. Consider your coping style. Does having more information help you feel more equipped, or does it create more worry? Reflecting on this can help you decide if you might want to obtain more information, or if instead it might be better to focus more on relaxation techniques. Ask your medical team questions that you've identified about a screening or procedure and what options they can offer to help you feel more relaxed during your scan. We put together a few questions you might consider asking. What is the name of this test? Why do I need this test? How can I prepare for the test? How long will the test take? When will the results be available? How will I be notified of my results? You might come up with other questions of your own, such as, is the scan going to be loud? What will the machine look like? What will I experience? Will it hurt? Are there food or liquid restrictions? Will I need to arrange for someone to take me home after the test? State any concerns that you have about the test. If you require anesthesia or anti-anxiety medications, your imaging team needs to plan for those interventions, so please talk with your doctor. Now that we've covered some tools and resources to use before your scan, now let's talk about some ways to manage anxiety during the scan. Talk with the diagnostic imaging staff about what interventions your imaging machine offers. Some machines play music. You might be allowed to wear an eye mask, earplugs, or put a cool washcloth over your eyes. A family member may be able to remain in the room with you to hold your hand during the scan. Depending on the type of test you're having, if you've discussed taking medications for anxiety with your medical teams, be sure to bring the medications with you, but don't take them until the staff instructs you to do so. Another method for managing stress of a scan is using breathing techniques or mindfulness. We'd like to introduce you to 2 techniques that are brief yet effective during a moment of heightened anxiety, like going through the actual scan. We've included some summaries of these techniques on the resources page, so you can turn to those and we'll go through them together. The pursed lip breathing is safe. It can be helpful for people that experience some shortness of breath because this doesn't require deep diaphragmatic type breathing. You can use the pursed lip breathing during your scan because it can be done while you're seated or lying down. What you'll do, I'll explain it and then we'll practice it together here. You'll inhale slowly through your nose for 2 counts, keeping your mouth closed. Doesn't need to be a deep breath, just a normal breath. You'll pucker or purse the lips like you're going to blow on some hot tea while breathing out for 4 counts. Some people like to imagine hot cookies that have just come out of the oven, where you breathe in for 2 counts to smell the cookies and out for 4 counts to cool off the cookies. If the 2 count in, 4 count out breathing is too long, just breathe in with what you can comfortably do, and then extend your out breaths for twice the length. If you'd like to join me, let's try this together here. Breathe in normally through your nose for 2 counts, keeping your mouth closed. Pucker your lips and blow out while counting to 4. Let's try it 2 more times here. The next technique we'd like to introduce you to is called the 5-4-3-2-1 grounding technique. You can use this exercise at any time to take yourself out of that worrisome future thinking and come back to the present moment. Sometimes those thoughts, the worst case scenarios, those thoughts just kind of take off like a runaway train. And we really want to come back on focusing on being grounded in the present moment. This can, in the grounding of this exercise, it can be a positive distraction from an anxiety-provoking situation. To use this, you'll slow down and notice 5 things that you can currently see. You'll notice 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. I'll give some examples here. For 5, look around. Look around for 5 things you can see. You can say them out loud. I see a clock. I see a chair. For 4, that's feel. Pay attention to your body and think of 4 things that you can feel. I can feel my warm sweater right now. 3 is listen. Listen for 3 sounds. You can say those 3 things out loud. I can hear the computer humming. Next, for 2 is smell. Say 2 things that you can smell. If you can't smell anything in that moment, then you can name 2 of your favorite smells. I love the smell of baked cookies. For 1, it's taste. Say 1 thing you can taste. I can taste my toothpaste from brushing my teeth. To learn these 5 things, you might want to write down these prompts on your own and practice them in everyday situations in advance of your scan. You can put them on a card and carry them with you in your purse or your wallet until you become familiar with those 5 things and can recall them. Then you can take those techniques with you into your scan.
So after the screening, I think a lot of patients experience that it's actually after the scan where they find they have the most anxiety. It's that period between the scan and waiting for your results. So it's important to talk to your medical team about when the results will be ready and how exactly they'll be communicated to you. This can help you to set an expectation and keep control over when you're going to actually receive the results and how and what to expect. And you may want to plan to have a trusted friend or a family member be with you when you get those results. It's also important to recognize the courage that it took to go through these exams. You are a strong, resilient person. You faced your fears and anxieties. You've gone through the scan, and that's something really important to recognize. You've taken an active role in your healthcare, and you've done everything that you can to obtain more information. So while you're waiting for the results of the scan to come back, it's helpful to focus your thoughts and energy on other things in your life that you do have control over. So there's nothing more in this moment you can do to regain control. You've already gone through the test. So now you have to ask yourself, what in my life do I have control over that I can focus on? So this may be just getting back into your daily routine, going to work, taking care of your children. It may be getting back into a favorite exercise routine or going for walks to help calm yourself. It might be spending quality time with your family members and your loved ones just to help keep yourself distracted. You have to find what works best for you, what keeps you feeling calm and in control while you're in this waiting period. And that's what's going to really empower you to have some control over your anxiety while you're waiting for that information from your doctor. So Wendy Harpham is an internal medicine doctor and also a 27-year cancer survivor. And she offered her perspective on the results of waiting for the scan. And I really liked what she had to say. So she stated, I found relief in a triad of expectations. So first, expect just to get any results. Expect that the results will help me. And expect to accept and deal with whatever the results might say. In other words, accept all the uncertainty and focus on the benefit that comes from the test results. So she states, more than I hoped for good news, I hoped for accurate news. And it's important to understand that when you get your test results, you may experience a wide range of emotions. Even if the results are positive, if they're negative, if they were inconclusive and they require more testing, you may cope in ways that you didn't experience, respond in ways that you didn't experience. There's a lot of different emotions you may find that you have. And even if your results come back without evidence of disease, being told that you don't have a particular diagnosis can be relieving, but also upsetting as well for some. So maybe you are being screened for something that runs in your family, and you found out that you're the one that doesn't have it. That's something that we call survivor's guilt, of knowing that other family members are going through this, but your test came back negative. So it's okay to be kind and forgiving with yourself over the different kinds of emotions and experiences that you might have. So once you have the results, it's important to talk to your doctor schedule a follow-up appointment to figure out what next steps, if any, do we need to take together. And you may be interested in talking to your institution's financial clearance center or talking to your insurance company to learn more about the benefits you have for your scans and any financial or billing questions or concerns that you might have.
Now that we've covered some techniques that you can use, we want you to know that you're not alone in facing and addressing anxiety along the way. There's some resources that can help at every stage of treatment. Talk to your doctor to find out who's on your interdisciplinary team. What are their roles and some of the ways that they can help or support you? You might want to talk with a social worker like ourselves about available support such as counseling, support groups, or other programming that can enhance healthy coping. Here are a few other departments and disciplines to know. The Integrative Medicine Center offers consultation with doctors to learn about complementary therapies to support physical, mental, and emotional well-being. There are some free fitness classes for patients and caregivers to attend. A physician's referral is required for other services, which may include acupuncture, psychology, exercise counseling, meditation guidance, music therapy, nutritional counseling, and oncology massage. My Cancer Connection is a program led by Volunteer Services. This program connects patients, survivors, and caregivers with trained volunteers who have had a similar diagnosis, treatment, or experience. Chaplains help patients, caregivers, and family members improve their quality of life through spiritual well-being. The supportive care team works closely with patients and families to address difficult physical or emotional symptoms to enhance quality of life. Psychiatry Services offers medication management of cancer-related depression, anxiety, and disease-related symptoms like insomnia or fatigue. They also offer psychotherapy services. The Employee Assistance Program supports MD Anderson employees experiencing personal, relationship, or workplace difficulties. We'd like to close our presentation today by taking you through a short guided muscle relaxation. We hope that by experiencing this today, you'll find that even if you only have 5 minutes in your day, these short exercises can relax your body and refocus your mind. Now, you'll now have 3 different kinds of mindful breathing exercises to choose from for managing scan anxiety. And if you find this exercise to be helpful, we encourage you to visit MD Anderson's Learning Center to explore some of their meditation CDs that can be checked out. You can also visit the Integrative Medicine Center website or choose from some of the smartphone apps that we've listed on the resources page to access meditations and breathing exercises online. In this technique, we will progressively tense and relax different muscles in our bodies. You'll intentionally tense each muscle, then release the tension and feel the muscle relax. If you experience any pain or discomfort in any areas of the body, don't tense those muscles, just focus your mind on that area and rejoin us once we've moved on to a different part of the body. Be gentle with your body. To begin, come to a comfortable seated position, resting your back against the chair. Put your arms down at your sides and close your eyes if you wish. Now begin to become aware of your breathing. Focus on slowing down the rhythm of your breathing. Your chest and abdomen will expand outward with each breath, like a balloon gently filling with air, which gently gets smaller as you exhale. Imagine your rib cage moving out to the sides when you inhale. and gently back inwards as you exhale. Take a deep breath in, pause for a moment, and then exhale slowly. Let the tension melt away as you relax more deeply with each breath. Now turn your attention to the top of your head. When you're ready, tighten the muscles in your forehead by raising your eyebrows as high as you can, holding, holding, and release, feeling the tension fall away. Let the muscles in your forehead completely relax. Breathing in and breathing out. Next, we will tense our muscles in our mouth and cheeks. Smile as wide as you can, holding, 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 and release, feeling the tension melt away. Let the muscles in your mouth and cheeks completely relax. Breathing in and breathing out. Now, tense your shoulders and lift them up towards your ears. Hold your shoulders for a few moments. Hold, hold, tensing, and let go. Letting all the tension drain out of your shoulders. Breathe in and breathe out. Slowly, as you imagine all the tension, distress, the pressure flowing out of your body. Now imagine that you are a bodybuilder. Flex and tense the muscles in your chest, arms, and make a fist. Hold, 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 and release. Letting the muscles in your chest, arms, and hands relax. Breathing in and breathing out. When you're ready, bring your legs together so they're touching. Imagine there's a penny in between your legs that you need to hold up. Now squeeze your legs against each other. Squeeze, squeeze, hold, hold, and release. Letting the muscles of your legs completely relax and imagining the tension flowing out into the floor. Breathe in and breathe out. Next, we will tense the muscles in our calves or lower legs. With your feet firmly planted on the floor, keep your heels planted on the floor, but lift your toes as high as you can towards the ceiling. Feel your calf muscles flexing and tensing. Hold, 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 and release. Letting the muscles of your lower legs completely relax. Breathing in and breathing out. Finally, we will tense the muscles in our toes. Curl and scrunch your toes down toward the ground, tensing your feet, holding, 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 and release. Letting the muscles of your toes completely relax. Breathing in and breathing out. Now imagine a wave of relaxation slowly spreading throughout your entire body, beginning at your head, and going all the way down to your feet. Feel the weight of your body on the chair. Feel the weight of your relaxed body. Gradually scan your body and notice how you feel at this time. Notice any sensations in the muscles of your forehead, your cheeks and mouth, your shoulders, your chest and arms, your hands, your upper legs, your lower legs, and your toes. If you notice any lingering tension, feel free to tense the muscles again and relax. Breathing in and out. In and out. In and out. And just rest in your chair. When you're ready, you can open your eyes. We've come to the end of our presentation. Thank you so much for joining us today. We hope that you all have identified some strategies that will be helpful to you. We'd like to invite questions and feedback now. We're really curious to hear what's helped you all manage scan anxiety.
Does anyone have any note cards that they want me to come and grab? Questions? Yes? I have one, so if you're thinking about it, I'll let y'all introduce this one. What can caregivers do to ease the anxiety of scans?
It's a very good question. And we know that caregivers go through just as much anxiety as the patients. And you are with the patient by their side throughout this whole experience. So you probably have your own anxiety, as well as feeling that sense of responsibility to calm the anxiety of the patient. So it's important to figure out what works for you depending on your relationship. Some people might prefer, they really want to talk about the feelings that they're having. Other people cope better through, I just want to be distracted, I don't want to think about it, let's talk about something different. Or maybe let's get up and go for a walk together to just sort of ease the anxiety that I'm feeling in my body. So it's important to try a couple different things together and to understand that everyone has a different coping style. So what makes you feel calm and relaxed might not work for the patient and vice versa. So to be understanding that what works for you may not work for them, trying to understand what works for each other, respecting each other's differences, and seeing how we can best support each other through this anxiety that we're all experiencing.
Any other questions in here? If not, we're going to see if any of the remote locations. Katie, do you have any questions?
We're checking right now. Yes, we have a question.
Great. Feel free to ask it away.
I'm concerned each test, each test has a different level of radiation, which is very important for patients that are aware that radiation is actually not so good for us. So I would like to know each test how much radiation and how much of it I can get over my body, because this is my first degree concern.
Did you understand that?
Yeah, absolutely. That's a great question. I think what first comes to my mind is spending a bit more time on the Diagnostic Imaging Procedures website that describes more specifically about the scans. They, in fact, have a section here to learn more about the radiation exposure. I think that would be a great place to start. I think also, in addition to that, being proactive in communication with the medical teams about your concerns, we would certainly recommend doing, and letting them know concerns that you do have about radiation exposure, and going back to some of those questions that we mentioned, asking, why has this test been selected for me? Is this the best test to capture the information that's needed given what we know right now? So I think just starting some conversations with the medical team.
Yeah, it's a very good question, and a very common concern is exposure to radiation, because there are negative effects that radiation can cause. So I would encourage you to discuss with your doctor your concerns about exposure to radiation, how much radiation is safe for me to experience, and what kind of side effects could come from the radiation. So it's a great place to start is these resources we have online, as well as just talking to your doctor about your fears.
Yeah, thank you for your question.
Any more on Katie? Okay, we'll move on to the Woodlands then. Does anyone have any questions in the Woodlands? I'm guessing no. League City, how about you guys? Any questions?
We have a question in Katie.
Okay, go for it, Katie.
I hope I can get this out without crying. My friend passed away in October. She had breast cancer. I have exercised, I've done everything, but the closer I get to my mammogram in March, the more hysterical I get. And I don't know what to do. And the relaxation, I try the exercise. Well, I walk every day. I keep saying I'm gonna go to water aerobics and see if I can get in the swing of things, but I am petrified. It is not about stress. It is out and out, downright fear.
Thank you so much for sharing that with us. I think there's a lot of different strategies that we can work together to see what does work for you, and I want to commend that it sounds like you've already been proactive in trying your best to address these feelings that you're having. You've already tried some coping strategies. I'd love to get you connected with your social worker so that they have time to sit down with you and explore what's working and not working for you, and we can try to see what resources are out there to best support you. So
I've spoken to Heather. I've met with her. She called. I was fine at the time. That was in January. And now I just feel it.
It's getting closer.
It's getting closer and closer and closer. And I feel like I'm going to self-destruct before I get the results.
Okay. So Kristen and I do have our contact information on the slides, and we'd love to talk to you a little bit more about what you're going through. We're going to pull that up right now so you can write down our information, because we'd love to follow up with you and talk a little bit more in depth about the feelings that you're having.
Thank you.
Thank you.
So we have a question in here, and then we'll go to the Woodlands, because I know that the Woodlands has another question. So this question is, I have always been told that I cannot take anything in with me for PET CT scans, but I know that one patient took his phone in with him to listen to music at one point. Is there a reason that I cannot take a phone in to listen to music? And then the second question is, also I've said that I'll be taking Xanax, and the nurse says she will let me know in 30 minutes. But it's hard to relax because I've had to stay on top of the time, and I don't have a watch, and the whole idea, I mean, I'm putting words in this person's mouth, but the whole idea of taking the medicine is, like, so is there some way to keep time, for them to keep time and you not have to kind of keep on top of it?
I'll answer the second question first. I know when I talked to the diagnostic imaging team, they did mention their reasoning for wanting to know when the medicine's being taken is sometimes there are unforeseen delays. And so if you were to take the medication on your own and there was some kind of delay and the test was pushed back a little bit, the medication you took might not be at the peak of its effectiveness when you need it to be. So that's why they're trying to encourage everyone to work together on when the medication's taking, because they know when you're going to go into the test, if there are any delays, and they try to time it the best that they can to make sure that you are relaxed when you're in the actual test. So it's a good question, and just we encourage you to communicate to the diagnostic team who's caring for you your questions or concerns regarding your medications. First question about bringing the cell phone. That's a good question. I think I'm not sure the exact answer to it, why one cell phone was allowed and one wasn't. I know different types of scans allow for different technology. Some you cannot have any metal on your body anywhere. Others may have different rules. Some machines do allow for you to listen to music. Others you can't have any headphones on. So good question.
And I meant in the hour that I'm waiting.
Okay, in the waiting room, not having your phone or not having your phone.
There's always the lighted pictures, and I know I think you're supposed to focus on that. They want you to relax, but I know, like I say, that one man he said, "I'm going to be listening to music." Maybe the cell phone. I'm sure they think that if you have your phone in there, you might do other things.
So from experience, I know that in one of the machines, you can give them your cell phone and they can play that specific music. I mean, I had a chest, abdomen, pelvis MRI once, and I asked if I could listen to my music. But I've also had a machine where there were no headphones and no music. So I think, just like they said, just ask, because they're there to accommodate you. And if they let you have you listen to your own music, it will have to be on the outside of the room. But I'm sure that if it's possible, they'll let you do it.
I volunteer in the PET scan department. I volunteer this afternoon in the PET scan department, and as a general policy, we do not allow phones into the room, though sometimes we do allow if they are in fact listening to music. But you have situations where I remember years ago while I was taking PET scans, a woman snuck a phone in and she proceeded to talk. A child, or he was a youngster, took a phone in and proceeded to do a Playboy type thing, where he was going. So when he took the PET scan, the woman who talked had her mouth light up. The boy who did it had his hands light up, which was not a good indication of the PET scan. So again, the general reason is because of the possibility of abuse of the phone. When I say abuse, if you are talking, it's going to show up on the test. And we want you to relax, sleep preferably.
Yeah.
But it's not a hard, fat, and fast rule. If a person is uncomfortable and needs the phone for the music, but only for the music.
Yeah, so I think
Does that answer your question? And I'll be guilty of saying no, to be honest with you. Simply because of not trusting people, which is odd.
I've never asked.
yeah, so I think
But
it's
when I saw her, that the one man,
Mm-hmm.
this is over many scans, about 2.5 years, but maybe he was, I don't know.
we have to move on to the Woodlands. I know someone had a question there.
Yes, can you guys hear us?
Yes.
Okay.
The comment is that these same techniques can be applied to other tests. I volunteer in the genital urinary department. A lot of the tests there are blood tests. People are still waiting to find out what's going on. And so that's just a suggestion. Next time include those as well. That's all.
Yeah, the interventions, like you said, it's not always just when you're in the test. It can be before the test, when you're in the waiting room, waiting to get called. These interventions you can practice to help calm yourself beforehand, certainly.
Okay, guys, we have time for one more question, and those in survivorship phase. Oh, sorry. Where?
Katie.
Oh, okay. Let me ask this question, and then we'll come right back to you. We just kind of have to wrap it up because we have a time limit, but 1 second. First this, and then we'll come right back to you. Those in survivorship phase, how do you handle the change to only being scanned yearly and the anxiety that comes with that?
Yeah, that's a very good question. So for some people, they're getting their scans very, very frequently and waiting for those results. For others, it's almost like a year-long buildup to your annual scan and what to expect during that scan. Even if you've been out of treatment for 20, 30 years, that time limit, you still can experience anxiety when you have to have your annual scan. So we encourage these same interventions, same strategies. It's, even though it may be a different situation, it's still normal to have that anxiety no matter how long you've been in survivorship.
We have time for one more question. Katie, if you can make it quick, then we will have to wrap up.
That was Leak City that had a question.
Sorry, City.
A number of the things you referenced were on slides that I don't recognize from the patient manual, and they're not handouts that we have here. So especially videos that you were showing and other things. Where are those materials available?
Okay. We have the diagnostic imaging. Oh, okay. So the PowerPoint will be available for anyone to access on the My Cancer Connection website. Oh, okay. Diana is mentioning as well, if you put your email address on the sign-in page, she can email that out to you all. Were you referring to this diagnostic imaging procedures page with the different videos of the screenings and scans?
Yes.
Okay.
So if you were given the resource handout, the resource list, on page 2, there's a section called MD Anderson Diagnostic Imaging. And we've copied and pasted the link to this website, as well as I have a pathway with sort of the step-by-step click buttons for how you would access this website.
Thank Thank you.
So we want to thank our amazing speakers for being our experts today on skin anxiety. In front of you all, there's a program evaluation. If you wouldn't mind filling that out, that will help shape future lunch and learns. And also, there's a section where you can suggest topics for other future lunch and learns, and either Diana or myself will happily pick them up from you. What we learn from you is how to shape the future sessions that we have, and you're the most important feedback that we can get from this. So thank you, ladies, very much. It's a great topic.
Thank you. Thank you all for joining us again today. We'll leave our email addresses on the screen here. If there's any feedback or questions that you didn't get to ask or didn't feel comfortable sharing in this space, you're welcome to email us directly. Thank you.
Thank you.